Last Ceann Comhairle, I wonder whether the issue of trans rights in education and in healthcare came up in the discussions with church leaders. The Catholic Primary School Management's Association recently wrote to the government arguing that students should not be taught what it means to be transgender, arguing that it would be, quote, counterproductive, generating unnecessary divisions and, quote, more seriously, it might add to a growing psychological contagion amongst young and vulnerable children. It's bizarre language seeming to suggest that being trans is some sort of contagious disease. So I wonder whether any of that came up in discussion. That relates to the question of trans healthcare, where Ireland is at the very bottom of the pile. A 2022 report by Transgender Europe rated Ireland's trans healthcare as worst in the European Union. And a big part of that is the failure to discuss with trans people, to bring their experience in to the centre of a kind of informed consent model that we need to develop. An example of that is the fact that the new clinical lead for transgender services in Ireland, appointed by the HSE, appears to have been appointed without any consultation, without any trans rights groups, without the trans community, about the role, about the person who's going to fill the role, with none of it. Does the Taoiseach agree that this is not the way to go about building an appropriate model for trans healthcare in this country?
I just want to put on the record that the government is very grateful and recognises the work done by the religious in Ireland and all over the world. I think given some of the scandals that have affected churches and religious bodies, and given the existence of religious extremism in the world, that sometimes that can be forgotten, but it shouldn't be forgotten. And we'll all know of people, nuns, priests and other religious people who've made an enormous contribution to society and have given their lives essentially to help others. And we see that in healthcare, education, housing, addiction services, poverty alleviation, for example. And it is easily forgotten that when the state was founded 100 years ago, we didn't have a Department of Social Welfare, we didn't have a Department of Health. Most people at the time didn't consider these things to be matters for the state, and was often left to voluntary bodies and religious bodies to fill that gap. Of course, things have changed so much since then. In relation to the Safe Access Zone bill, we intend to get that enacted this year. I haven't had any engagement with religious leaders on this specifically, although the last meeting I participated in was 2021, and that was quite some time ago at this stage, but certainly wasn't raised with me by the Papal Nuncio or by the Archbishop of Dublin. In relation to St John of God's, I'm going to have to seek an update from the Minister. I am aware of some of the issues that are facing the organisation, but I am fully up to date. But I'm sure these things will be resolved by negotiation. They always are. But I will seek an update from the Minister on today, given the fact that the deputies have raised it. Just in relation to education about trans people exist. They've always existed. Now they can be more open about it, which is a good thing, but we've a long way to go. And it's my view that it's right that children should learn about people who are transgender and what that means. I would prefer that children learn about these things from their teachers in their schools rather than the schoolyard, and from their loving parents rather than the internet. And if we don't have education in schools, I think we're letting children down in that regard. In terms of trans healthcare, it's a new and evolving area of medicine. It's controversial. There's a lot of disagreement within the profession about what the right treatments and diagnoses and investigations should be. There's so much we don't know about it. Still learning. I think it's very important that NGOs should be consulted. But as with any area of healthcare, really healthcare has to be based on science and science-led, not on politics. And I say that as somebody who's an LGBT advocate and a member of the LGBT community, but really healthcare has to be led by science, not by politics.